Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. I'm sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today, we'll be talking to Patrick, who is a family nurse practitioner that practices in New York. Currently, he is working part-time as a hospitalist, and he started a men's health practice 2 years ago. He has experienced significant growth over the past year as he has integrated more services into his practice, such as weight loss and IV infusion. He is experiencing significant growing pains as his practice has reached the $100,000 a month mark in revenue. He is needing assistance with growing his practice, developing systems, hiring staff, and figuring out what is next. Hey, Patrick, how are you?
Oh, I'm good, man. Thanks for the opportunity.
Yeah, no, for sure. I appreciate you hopping on this call. I know I've been talking to you, kind of mentoring you over the past couple of years. So it's been really crazy seeing your growth. So I'm really happy to have you on this episode. I think a lot of nurse practitioners listening to this will get a lot of value and a lot of motivation out of it. So with that said, yeah, bring me up to speed with where you're at. Tell us how long you've been a nurse practitioner for, what you've been doing.
Yeah, so I graduated 2016. I'm a family nurse practitioner. And when I first graduated, I started working as a hospitalist, the same hospital that I started with as a nurse. You know, I was overnights as a registered nurse. Then I got burnt out and I left and went to like a nursing home, and then kind of did a little bit of ER nursing and little tiny brief stay of travel nursing. And then, when I graduated in 2016, right before I graduated, I went back to the hospital part-time. So I did that for a couple of years, probably from 2016 to 2018 and a half, 19 full-time. And then actually full-time still, even when I opened my practice, but probably like 2019, 2020-ish, I had the niche to go on my own thing. Originally, it was going to be a direct primary care type practice because I was working basically 90 hours a week between overnight at the hospital, 8 p.m. to 8 a.m., 5 days a week. And then I was working part-time Monday and Fridays at a primary care office. And I was doing like this terrible online coaching or consulting for this big practice. And I just got burnt out, and I wanted to do more. So that I decided to open in June of 2020. And yeah, man, it's been a journey. So yeah, practice opened up during COVID. I was in New York State, so upstate New York. And of course, everything was a little bit delayed as far as opening because of COVID. But it's been a journey. It was a little slow in the beginning, but it basically exploded.
Yeah. I mean, you're a perfect example of, if you have an idea and you get started, you can even be successful in the middle of a pandemic. I mean, my practice grew significantly during COVID. And I know a lot of other nurse practitioners and just regular other businesses too. A lot of them either did really, really good or they closed down. So it sounded like you got on that upward trend. So yeah, congratulations.
Yeah. And Yeah, and I mean, a bunch of people have reached out after like the original interview, that we did, and everyone usually believed me after I explained the process to them, but they thought that I live in New York State, so of course the income is higher. But I explained to them, my area is in upstate New York. We're in near Woodstock, which is about an hour and a half north of the city. But I mean, our mall, our Hudson Valley, it's a Hudson Valley mall. Like our economy has been dead since the '90s, so we're one of the poorest counties. Yeah, there's pockets of money, and I try to explain to people there's pockets of money no matter where you go in the country. Yep. People think that, upstate New York, you're all this, very wealthy population, but it's not. So I tell people if my practice can be successful, any practice can really be successful. It's as long as, you practice the principles in that we talk about in the forum, like a niche, whether it's a direct primary care practice that markets a certain population or men's health, it doesn't have to be as complicated as people think. And I started out in June 2020. I had my first patient the day I opened. It was, a family friend. It was my first men's health patient. And then just it exploded, so.
Yep. No, that's a good point. I opened up my men's health practice in one of the poorest counties in the country. And we're making $70,000, $80,000 a month in revenue. We're killing it. You know what I mean? So there's always going to be money. Doesn't matter where you're at. There's always going to be people with money. Like always. Like so many people in nursing think that everything's Medicaid, everything's Medicare. Like they have this scarcity mindset and they need to get out of that damn mindset and realize that a lot of people have money and are more than happy to pay for these services cash. So you're a great example. I'm a great example with it. I know other people that are killing it too. And, quote unquote, poor counties. Yeah. So I think that's a really good point. So how'd you get started, man? Why'd you choose men's health?
Yeah. I had, very little experience in men's health, and full disclosure, this, for months before I opened the practice, we were messaging back and forth. And, I was telling you my plan is doing a direct primary care because that's really all I knew. And I thought, that's really all a nurse practitioner can do. I thought like when I heard men's health and hormones and stuff like that, I thought it was like not something that was not necessarily was in our scope, but, was not something that we were able to do. I had a little tiny bit of knowledge because when I was younger, I was into lifting weights and bodybuilding and things like that. But as far as the knowledge for practicing, I had absolutely no knowledge. And, just literally people don't believe me when I tell that, the original basic men's health course is really 99% of what you need to get started with a men's health practice. So, me, I was always originally affected with it. I've always had borderline low testosterone for my age. So I was like, this is something that might be interesting. And I originally, bought the course, and my original goal was to open up a direct primary care practice and have a little bit of men's health on the side, maybe to like get extra revenue. And
sure,
for me personally, it's the best decision I ever made was to listen to you, buy the course. And I learned very, very, very quickly that my direct primary care practice went from idea to an idea that I would never pursue. And I mean that, I have no problem with people that, I think direct primary care is great. I'm not telling people to not do it, but, I think that a lot of people in this group don't realize the ability to help people with men's health and even women's health. And, there's such a need for other ancillary services that, you really could eliminate a lot of stress that is put on, people put on themselves with, with primary care. But so I decided to do that because, there was a need. I think that, like you talk about in the course, after doing a little bit of research while actually I first bought the course and I did some data before, and it's a huge need. There's a lacking of it. And the attorney that helped me form my practice in New York State said the same thing, that, it's a huge need for that. It's neglected nationally. So, that was the original reason why I decided to go with that. And I'm glad I did because, the men's health has been my main niche.
Yeah, I think men's health is probably one of the most profitable niche practices a nurse practitioner can open up. I really do. I know aesthetics practices kill it. Weight loss practices kill it and whatnot too, but a lot of those require a lot of time. They're very laborsome, but men's health it's almost a partially passive income. And it's like, it's so easy and it's so profitable. Yeah, I really think it's one of the most profitable practices a nurse practitioner can open. I know you offer multiple services like weight loss and IV infusion and, do a little women's hormones and stuff like that. Would you say that your predominant revenue stream is going to be from men's health?
Yeah. So most of my money, the revenue is definitely the men's health. I think as far as I have the most amount of patients on subscription in men's health. My program's a little differently. Like for the weight loss, I don't have like a subscription base like a lot of other people talk about on the
Yeah.
Facebook forum. Mine is I just have them paid directly, and the only reason why is that it's hard for me. As we're going to talk about, I'm a one man shop basically. So to manage that many subscriptions and payment software denying and stuff, I'm not technologically advanced. I don't have that much of a system down yet. So for me, the men's health is what my bread and butter. Probably 75 to 80% of the revenue is men's health because, men's health, think that all you're going to be making is, testosterone, B12, sildenafil, but, there's so many other add-ons that, the advanced course and just talking to compound pharmacy, you can, add on to their stuff. And, a lot of the guys, if you get a good group of men that are into or get, you treat them well, they're going to do a lot of the research on themselves. Like, it happened to me. Like one of my guys, he's like, one of my first patients, he like literally looks up, other ways to treat and then comes to me. And, I'm very upfront with them. When I first started, yeah, I'm not really too, in tune with it, but I called the compound pharmacy, a quick 5 to 10 minute conversation with the pharmacist, learned about the product, do a little bit of, research behind the scenes that I can market that other product to other patients and who are, going through similar issues. So, men's health is definitely, like you said, it's the least laborsome way to add revenue significantly. So yeah, definitely agree.
Oh yeah. Oh, for sure. For sure. It is a significant revenue stream for any kind of practice. Yeah. Yeah. 75, 80% of your revenue is from men's health, testosterone, ED treatment, whatnot. The other 20% is weight loss, IV infusion. And you said you treat some women here and there as well. So you are growing pretty significantly. So, I've kind of been talking with you over the past, 2 years and, I've, month to month, you're kind of, keeping up to date with your revenue and whatnot. So what do you feel like that you did? Because your growth has been insane. I think that a lot of that growth is the right place, the right time, and a little bit of some luck thrown into it. I think you just happen to be in just definitely the perfect.
Yeah. So,
market. Yeah. So what do you feel like that you did that you can kind of pinpoint? Because like I said, your growth, 100,000 plus a month in revenue, for a one-man show is just absolutely insane. So what do you feel like that you did that helped you get there? Can you pinpoint to anything?
I think it was honestly being a sponge. And I would not say that I'm anything special as far as, more knowledgeable or more determined than anyone else. But really, I always joke around and say if it wasn't for like my wife and support at home, I probably would either be divorced or dead or the practice would fail because, she really does help out in more ways than that. But yourself and Justin Gross, I just tell people, the ability to be able to reach out to, gurus as far as, the business aspect like yourself and the men's health like yourself, Justin Gross, and, the IV course, other things like that, it really is something that to be a sponge and, to just kind of make yourself available. I think for me, the thing that I did was I took advantage of the situation. I had analysis paralysis for probably January of 2020 to February, March, where I was just overthinking everything. And, every time I would read something about, regulations and things like that, I would analyze things that didn't even matter, and I just kind of said, I'm either going to jump right in and do it, or I'm just going to sit and dwell on it for the rest of my life. And, I was not blessed financially. Like I said, I was working 80 hours a week. We just bought a house. I had a 2-year-old. My wife was pregnant with my son that we have now. I still had, 90,000 in student loan debt. And my wife had 22,000 in student loan debt. I had a car payment. We just bought a $40,000 Jeep. So like, these are all these obstacles that you could have focused on and said, it's not a right time to open up a business. But I said, what's the worst that can happen? I go back to working crappy hospitalist job and a primary care and getting abused. You know what I mean? It's kind of like, I just took the initiative and I kind of saw that in my community, I never really heard of a men's health clinic, locally. There was no real nurse practitioner owned clinics in my area. Like I said, my area is kind of a poor area. There's a bunch of primary doctor offices and we have like a little community hospital, but nothing like a big area. But I kind of saw the ability to capture a bigger market because in my local, my immediate town, Kingston, that was the next, the town that my practice is in, our population is about 35 to 40,000. But the Hudson Valley, within like an hour distance radius, you can capture about 150,000 total, and sometimes more, sometimes less, depending on the season. There's a lot of people that travel from New York City. So there was an ability to actually capture a bigger market. But I always tell people, like, when I first opened, I did not take advantage of the telemedicine ability. I was still in the middle of COVID, masking up, and I had people come into my office. I didn't realize the ability to just, see people virtually, during COVID. So, I mean, I could have even made even more. And I did very, very, very little marketing. I just basically had a referral program, which I still do. And I just, treated people well. And I mean, basically they spread the word themselves, which I still think word of mouth is still the best. Obviously, it's not going to take off as fast if you're looking to grow quicker. But as far as the steady growth, I think that if you have either a referral program or a point system or something, and it doesn't have to be complicated, you know what I mean? A couple of people asked me, how do I track the referral program? I said, I have a PDF spreadsheet with, the initials of the person that they, right on my work computer with the initials of the person that they, referred. And I just keep track of it that way. And I just tell people, if you know that you sent 4 people and they haven't, I haven't given you anything in return, just shoot me a message on the EMR and that's it. So, I mean, it doesn't have to be complicated, but at the same time, it becomes laborsome once you get to a certain point. But
That's where you're at.
It's exactly.
Okay. So basically just a great location, no competition, providing amazing customer service and word of mouth, basically. I mean, that pretty much sums it up.
Yeah. And I mean, I took your marketing course and I still, now I'm starting to advertise a little bit more on, social media for the IV fluids, and also because I am getting licensed in more states. But yeah, I mean, for me, keeping it, I guess you'd say, relatively small. And I mean, listen, I live in New York State. It's one of the most populated states in the country. I'm not denying that. But I mean, most of my clientele, initially was local, and
right.
Like you talk about in the course, you don't need, 10,000 men's health patients to have a successful practice. I had literally, I remember, and my wife and myself and my mother-in-law were talking about this the other day, I kept saying, if I could just get to 100 patients, at $10,000 profit, a month, at the minimum, and I'm almost there. And then, you look forward 2 years later and I'm, insane. I have 550, maybe 600, if not more subscriptions. And then I have people that pay up front. So, I mean, I don't even know how many men's health patients I have. I have over 1,500 in my electronic medical record. And like I said, about 70 to 80% are men's health patients.
I was going to say, man, with 100,000 plus a month in revenue, you have to have at least 1,000 patients, because we have about 600 or 700 and we're at that $70,000 mark. So I would say that you're at least at 1,000, man. Easy.
Yeah.
And that's just crazy. And that was, you have 150,000 people in your local market. Like the town that your practice is in, it only has 30,000 people. Listen, you don't need to be in a major metropolitan area. Like, some of the best places to open up a practice in this country are little podunk towns of 30,000 people. Like, those are the best places.
I know.
No one's there.
It's insane.
Yeah. No, I totally agree, man. Like, that's where my success is too. In just little towns. Like, it works fantastic. Yeah. So let's talk about your problems, man. So you have rapid growth. You don't really have any employees, correct? Like, you just kind of have some family helping you out.
So about 6 or 7 months ago, I made the mistake of, actually it was probably about 8 or 9 months ago. So right around when I left the hospital full time. So I was full time working 8 p.m. to 8 a.m. until last April, or I put my notice in to go from full time, 8 p.m. to 8 a.m. 4 days a week. So 48 hours a week. I was working at the hospital and I'm still seeing patients during the day. But anyway, I did that in April. And then about a month later, I put my brother on to do my back end filing, helping me label medications and sending out stuff in the mail when I started doing more telemedicine. So he was basically I 1099'd him. He was working, probably anywhere from 25 to 35 hours a week. And it was mostly filing, keeping track of my medication log, things like that. Because I was doing more IV fluids. So it was becoming laborsome, seeing patients. So that didn't work out. Not that it didn't work out. He got a better offer as far as the job and, kind of took advantage of what I was paying him. He was overpaid.
Quick little side,
not work.
Quick little side thing. Never hire family. All right, continue.
Yeah, exactly. So he left probably 3 months ago or 2 months ago now. So then my mother-in-law and my wife are basically doing what he did and doing it at a much better rate and, not taking as much money and, being much more, reasonable. But anyway, so they are basically doing what he was doing. And then in that time, just so happens, unfortunately for my mother-in-law and wife, and good for the practice, the expansion has happened significantly, more in that time. I don't know if it's like a coincidence because my brother, looking back, obviously, like you said, when you hire a family, mixed family with work, you kind of realize the nuances and the screw ups that happen. And it's different, if it's like someone that you're paying and isn't attacked, and your brother, who's my older brother, by the way, one of my older brothers. So it's like hard, I'm yelling at him, I'm his boss. But anyway, you realize the kind of stuff that they were screwing up. But anyway, so now I just have, they're doing the back end work for me. So what my problem is, or what my thing, the obstacle I'm having is, I was a one-man show, and then I hired my brother, and then now I have my wife and mother-in-law. I'm trying to figure out a way to continue to grow without making it more hours spent. Because the whole concept is, you talked about on the Facebook forum and stuff, is to be working on your business, not in your business. So I'm trying to come up with a system to be able to have it more systematic and less laborsome for them and me. And we've done some things, but our big problem is the growth. As we continue to grow, it's becoming harder and harder to, I guess you would say, catch up or expand at the same rate. Or, right now our personal life starts to get affected to it. It happened to me, like on vacation about 2 weeks ago, I went to Florida, and while I was away, I was getting hit up for things that I took the initiative and messaged people, a whole month before, and told them I was going to be away. If you need me urgently, you can email me or call me if only absolutely necessary. And of course, people don't care. They think the $150, the $150, retainer fee means that they own you. But anyway, so yeah, that's kind of where I'm at. I'm trying to expand at the same time, keep the practice as profitable as it is, or at least close to it. Because I know that as you expand, there's always going to be growing pains.
Oh yeah.
But yeah, my issue is that when I initially got started, I was doing everything by myself, so it was a lot easier to do everything. What compound pharmacy everything comes from. You know how to order, the workflow for yourself. But when you start to try to scale it and grow, the hardest part and the most laborsome part is getting the system, down pat.
Okay, so a couple things there. Working on your business versus working in your business. So some people might not understand what that means. Working on your business means you're working like literally on the business. You're marketing it. You're working on systems. You're working on ways for it to grow, right? Like you're working on it. Working in it is, you're basically an employee in your business, right? You're working in the business. You're answering phone calls. You're seeing patients. You're paying bills. You're doing those sorts of things. You know what I mean? And so then the other thing with this is that, you want your business working for you, not you working for your business. So your business working for you is like my practices. My practices work for me. Like it's great. I don't spend that much time in my businesses anymore. Like they work for me. Like I sit back and I see the money come in, and all I got to do is just keep working on it to keep it going, right? You working for your business is when you get to a point where you almost become a slave to the business. And that is where you are at. Like you are a slave to this business. Like you cannot escape. Like you just can't.
No,
you can't.
I go to the grocery store and I'm getting calls and hit up, and it's just like, the whole point of being a business owner is to be a little bit free,
Correct.
Yeah.
Right. Having your business work for you. Yes.
Yeah.
You're a slave to your patients. You're a slave to your business. Like while you are killing it and you've been able to pay off almost all of your debt and save a tremendous amount of money. You've managed to make some huge financial gains in the last year.
Yeah.
I'm proud of you, man. You paid off your debt. You're paying off your mortgage. You're building legacy wealth here.
Only debt we have is good debt is our mortgage, and the whole goal is to have that paid off by the end of the year. So my whole goal before I expanded as quick as we are, and it's starting to take a toll on me and my personal life, was I wanted to have the house completely paid off, and then the whole goal was once that happens, then it was become to either slow down and not really rely on needing as much profitability, or I guess you'd say revenue. So that hopefully will still happen as far as the house being paid off this year. Although we keep adding more stuff to our renovations, and we had a bunch of crap happen in my house. But anyway, that's a whole nother thing. But I think the best method of attack is to figure out a way to free up more time, because the way my business right now, I answer my own phone. The phone call comes in, and I get when I make an ad on Facebook, I'm the one answering the ad, and so it's very laborsome. And I guess my question for you is, how do you, when you have your MAs, or I know you have a nurse practitioner that works for you now, is it, I guess I'm struggling with the idea of your first point of contact for your business, right? Because, let's not sugarcoat it. There are some employees that don't care. They come, and especially if they're either 1099 or a relatively low salary for, how they feel from what they're contributing to the practice. My fear is losing the niche of being accessible, but at the same time effective at what I'm doing. You know what I mean? If you can
I totally get it.
Have a $20 or $25 an hour employee make, free up your time to make another, $200 an hour profit for, seeing either more patients or spending more time selling a higher, profit, then it's worth it. But I just fear, if it's not someone that has an invested part of the practice, how do you train them effectively, and how you, I guess it's a risk, right? It's a risk. You worry
it's a risk.
You're gonna,
Yeah. There's always going to be employees that don't give a shit. It's not their business. They don't care. It's a job.
Yeah.
Right.
Yeah.
And so the only way that you can get over that fear and to ensure that people do a good job is, you have to incentivize them. You just do. You have to treat them very, very well. And so in my area, I pay my medical assistants $20 an hour. Okay. Which they will not find another job in this entire state for a medical assistant for $20 an hour. They're not going to. They're just not. It doesn't exist. And so I pay them the best that you could possibly make as a medical assistant. Additionally, I give them $1,000 Christmas bonus, and I give them $1,000 4th of July bonus. Tell me another MA position where they're going to be compensated that way. It doesn't exist. Yeah. Like, you think the hospital is going to pay him that? Shit, come on.
No.
Right. They're going to nickel and dime them to death, right? And so you just have to treat your employees well. If you treat them well, they'll do a good job. And if they don't, fire them immediately. You know what I mean? Like, come on. You're not going to find a better deal than this. You're just not going to. So I expect good work. And so what I do with my MAs when I hire them, because I have 4 of them. And so when I hire them, I tell them, I'm going to start you out at $15 an hour. And in 3 months, if you show me that you're good and that you care and whatnot, we're going to bump up to $20 an hour. That's a $5 an hour raise. It takes people years to get a $5 an hour raise. Like, it's just 50 cents here, 80 cents here, 25 cents there, just insulting stuff, right?
Yeah, exactly.
Okay, in 3 months, I'm going to give you an extra $5 an hour. That's life-changing money to a lot of these people, right? They're going to do a good job. They're just going to. If they don't, you fire them. That's why you do a 3-month, $15 an hour, kind of trial period, so to speak. And so, can they still screw you over? Of course they can, man. That is the risk of having an employee. Like, you have to just get over that fear. And I think that's, honestly, man, I've been talking to you for the last 2 years. I really feel like that's probably one of your biggest hangups here, is that you have to just learn to trust people. And you have to just get over that fear. Like, you just have to, man. Like, for you to grow this business any further, and for you just to not pull your hair out, man, and, go down the road of divorce. And there's so many entrepreneurs that get divorced and stuff because they're slaves of their business, right? So for you to avoid all these bad things that can happen, you're going to have to just trust someone. You just going to have to. And so you need to interview 5 to 10 different people and pick the best one that, that you basically jive with the most. You know what I mean? One that you can relate to, one that you get along to. Your patients. And so what your patients will like and what they will want. You know what I mean?
Yeah.
So you just have to choose the right one. So if I was you, I don't know what the going rates are for MAs in your area, but I would add on another $5 to $10 an hour to that and make it worthwhile. And also tell them that there are performance bonuses quarterly or every 6 months, and be a man of your word and pay them on that, man. Like, when my MAs get that $1,000 bonus, they come up to me and they're just like, thank you. I was not expecting that. I'm like, it's a pleasure. Don't worry about it. I buy them lunch all the time. You know what I mean? This is all deductible, man. It's all tax deductible. Hell, I buy lunch for the entire office all the time. Why not?
Yeah, exactly.
So, I'll fill up their gas tanks for them every once in a while. Like, it's a good place to work. You know what I mean?
Yeah, exactly.
Right. So that's the beautiful thing about having a small business, man. This isn't corporate America. You don't have to deal with all that bullshit, HR and all this nonsense. Like, it's just your own little practice. Like, you can actually be a real person, not the bitch over in the HR office that everyone hates. You know what I mean? Like, you could be a real person and treat people good, treat them well, and they'll treat you well too. So, like, I don't think I'd worry about it, man, in terms of that aspect goes.
Yeah. And then
you have any questions with that?
So are you doing mostly telemedicine right now with like COVID and stuff? Or are you still seeing people in person, or?
Half and half, I would say. I'd say I see the majority of my patients for their first visit in person, I just like
Okay.
to shake a hand. I like to see them. You know what I mean? I just do.
Yeah.
And I think a lot of guys like that as well. But some people they just want to be seen telemedicine, which is fine. So I'd say it's one of those things that for the first visit, I see the majority of them in person, and then 95% are follow-ups or telemed anymore. I mean, they just are. Men don't like to come in the office. You know that.
Yeah, exactly. Yeah, because my thing is for as far as for workflow, because I'm primarily telemedicine. I mean, I haven't stepped foot in my office in the last probably to see a patient probably like 9 months.
Wow.
So yeah,
okay.
yeah. I mean, which is not a bad thing for me or for the patient, but eventually I'll be back in the office. My nurse is in the office. The 1099 nurse is in the office a couple days a week. But
And the 1099 nurse is the one that's doing your IVs for you, right?
Yeah. So I was doing all my own IVs, and then it became to the point where I was going to my office and sitting there for if it was a good day, it was great. It was I would see 6, 7, 8, 9 IV patients, and in between I would pop on and do a telemedicine for either weight loss or men's health. Or sometimes the men's health would come in for an IV. So it was great. The revenue was great those days. But then it got to the point where there was cancellations or someone changed their mind. And so I mixed the bag. So for me, it was, like I was sitting there, I had to make the decision, either pay a nurse, $40 a bag and make $60, out of the $100 profit, I make 60 to, $80 profit if they do other add-ons on the bag. And they just, they take care of everything, and I could freeze me up to do other things versus, me do all of it.
Wasn't that a good decision though? Do you not love having more time?
Oh yeah.
$20, the $20 in profits, nothing, man. Who cares?
Yeah, exactly.
Right. I mean, you're making, this is $1 million practice, like $20 here and there. Who cares?
Yeah, exactly.
Yeah. So I think that's another thing too, you need to change your mindset on too. I think you need to change your mindset on, what is it that you want? You want to keep killing yourself and squeeze out every single dollar you can out of this business? Or do you want to make still a pretty healthy income? I mean, you can still profit at $500,000 a year off this thing easy and have so much more free time though. Like, what would you rather have? Would you rather have $750,000 in profit and keep killing yourself? Or would you rather have $500,000 in profit, work 20 hours a week, and have your life back? Which one sounds better?
Exactly. The option B all day, there's only so much time,
Right. And so you have to just delegate work to others, man. You just do. And you have to develop systems. And so if you want to talk about that, I can tell you kind of an easy strategy on how to develop systems, man. You can copy and paste. Yeah, this is super easy. The easiest thing in the world, okay? All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. You get on your computer and you get your microphone out, load up Zoom or whatever, and click share screen and record. So you're basically recording what's on your screen while you're recording your voice, right? Piece of cake. Okay. So now you're recording your screen and you're recording your voice. You are going to create training videos for the MAs, for the nurses, for whoever you hire on how to do things in your business. Processes in your business. This is why policies and procedures manuals, I think, are somewhat obsolete anymore. Like, why write out this when you can just record a video and have them watch it, right? And so you're going to develop a procedure. You're going to develop a system on how to schedule an appointment with the EMR. You create a video on that and you're talking through it on how you do it and how you want them to do it. And then you create another video on how to order medications from the compounding pharmacy. Create another video on how to input information into the Excel sheet for the referral system. Then you create another video for all these things that you do, okay? You're already doing them anyways, so you don't have to spend extra time doing this, dude. All you do is like, okay, well, I have to insert this order into the compounding pharmacy right now. So let me load up Zoom real quick. Let me record my screen. Let me just record my voice real quick, and just to take an extra 5 minutes. You're going to do it anyways. So you record that. You put it into a Google Drive or whatever, you save all these things. And then when you hire a medical assistant, you hire an office manager, you hire a nurse, you hire whoever you want, you have them watch those videos and ta-da, you have a system now. It's a piece of cake, dude. There's nothing to it. Now you have systems. You think you could do that?
Yeah, no, it's definitely something doable. It's just a matter of, cranking it out and making the process easy and streamlined for, the MA or, either the virtual MA or the one that's working for me or the provider, whatever I end up doing. Yeah.
Right. The same thing with the providers, man. Like, you want to hire nurse practitioners to do these things for you, right? And so I have 2 nurse practitioners that work at my men's health clinic. I honestly need a third one because I don't want to spend more time there. I don't. You know what I mean? I'd rather just work on the business and have it work for me. I don't want to see more patients. And so I just created basically a little procedure sort of a thing. It's just, I type it out on, this is how I want you to see the patients. If the testosterone level is over this number, you do this. You start at this dose. If it's over this number, you start at this dose. On follow-up, if the testosterone level is here, you drop the dose down 10 milligrams or whatever. Like you write out what's in your mind on the paper. Okay. Give it to them. And you're like, this is how I want you to practice. Do you have any questions? I mean, it's a little upfront work. And I'll be honest with you, it kind of sucks. I did not enjoy writing those procedures. I did not for my nurse practitioners. But dude, it's great. I just email it to them. They just read it and now they can start seeing patients. And then of course, they text me the questions or whatever, during the training period of it. Or you can even have them watch just the clinical component of the men's health course. But make sure you shut it off for the business component because you don't want them to know how easy it is.
Exactly.
Yeah.
That's my other fear, is hiring someone and then they find out about the elite nurse practitioner group and how easy it is. And then, they basically go and open up a practice down shopper and, next time over, which whatever, there's enough.
Listen, dude, most people don't want to start a business. They just don't. They just want to work, get paid, and go on with their life, man. Most people, that's what they want. They don't want to start a business. So don't worry too much about that. Like, don't, seriously. They just don't. They just want to go to work, get a paycheck, and go home and not have to worry about it, right? So don't worry too much about that. You can sense that when you're interviewing them, though. If they sound like they're kind of an entrepreneurial, kind of spirited person and talk about how they want to start their own practice or whatever, don't hire that person. Like, you're going to just train competition. Yeah. So
exactly.
Don't worry too much about that, man. I wouldn't.
Okay, cool.
Yeah. Do you have any questions about that? I think that if you just record some videos, now you got some systems, dude. It's really that simple. It's not complicated.
Okay, cool. And you use like Google Drive to record and stuff like that?
No, so I just use Zoom. So like if you go on Zoom, I mean, I'm sure there's all kinds of software that you can buy that records the screen and stuff for you. But I mean, I already pay for Zoom, so why not? So you just basically load up a Zoom session, click share screen. And so now the screen is what's being recorded when you press record. And then you sit there and just talk in a mic. Yeah. Just kind of explain what you're doing basically.
Okay, cool.
And with Zoom, I think you can have a free session up to 45 minutes. So you don't even have to pay for it, man.
That's awesome. Yeah.
Okay. Yeah. And then upload those videos to a Google Drive. So that way you have it saved in the cloud. And then that way, whenever you hire someone, you can just load up that, create folders, how to book a patient in the EMR, how to order a medication, how to do this and how to do that. You know what I mean?
Okay. Yeah.
Yeah. If you do that, you build that stuff out, man, it'll be so easy to onboard new medical assistants and RNs and those sorts of things. And then you're going to start getting back more time. And then what's going to happen is that sure, you'll be paying out more money to the employees and you have workman's comp insurance now, you have employment taxes, you have all of this crap that you got to pay for having an employee. But what you'll find is that revenue will go up because it's more efficient now. And now you're spending your time on income generating activities versus busy work. And you won't even see probably a difference in your profit.
Awesome. Yeah. That's what I'm looking forward to, having a little bit more passive and self-run.
Yeah. So you have any questions about hiring anyone or developing systems or policies or procedures?
I think I'm good on that. You just create like an ad on Indeed.
Yeah, absolutely. No, I just put an ad on Indeed, Craigslist, and Facebook Marketplace. And that's going to pretty much hit just about, 90% of people looking for jobs. And so,
And you 1099 your MAs, or you hire them full time?
no, MAs are going to have to be a W-2 employee. You can't justify them being a contractor. Okay. Yeah, you just can't, man. Yeah, because they're an employee. So you could get away with doing 1099 if you want, but once you get audited, man, you'd have a lot of self-employment taxes you'd have to backtrack and pay on and stuff, and you'd be hit with a big fine. So just do a W-2.
Okay.
And you're only paying 7% of self-employment taxes on your end as the employer. So it's really not that much money. Don't worry too much about it.
Cool.
Yeah.
Okay.
Any other questions about hiring people?
You start out with, in my situation, you think you start out with like a MA first, and then
absolutely
down, and then high.
Yeah. Okay. Cool. 100%, dude. You are doing so much busy work. Like, you got to hire someone to start doing this busy work for you, answering the phones and ordering supplies and just doing all this little piddly stuff, man. You just got to hire someone to do that. And honestly, a medical assistant's great, especially if you can find one who's experienced, who's been like in an outpatient, medical office for 10 years or something. Like, they know a lot of this already. And honestly, man, those people who are experienced bring a lot of good ideas to your practice that you might have never even thought of. So start off with a medical assistant. If I was you, since you're doing mostly telemed anymore, I would still have them go to your office and be there as a receptionist. Like, they need to be there. That door, like when your Google business listing says that you're open and someone's there. So I would have them go there to work, have them clock in. You use QuickBooks, right?
Yeah.
I believe there's like a clock-in feature thing that you can purchase through them. Have them clock in, track their hours, have your accountant, bookkeeper, do the payroll for you. I mean, all that stuff is easy.
Yeah. She really does my payroll for me when I pay myself. So yeah.
There you go.
Cool.
Yeah. So I'd start there, man. Just like start small, hire one person, have them start, offsetting work to them, and then you'll get more time, and then maybe hire another nurse practitioner as you grow. And I think that once you have an MA, I don't know how you're doing $100,000 a month by yourself with the help of your wife.
Yeah.
Like, I mean, I have 3 MAs at my first men's health practice, and I have an MA at my second men's health practice. Like, I don't know how you do it.
It's very laborsome. It's a lot of hours, man. I'm up at 5 o'clock every morning, and it's a grind. And I'm putting in more hours than I probably would if I was a W-2, but this month, the 17th of the month right now. I'm at 85,000 revenue. You know what I mean? It's insane. And most of my recurring charges are at the end of the month, the second half of the month. So I'm probably going to hit over 100, 130, 140, 150. I actually canceled appointments yesterday and today to try and catch up. So I got like 10 or 11 new men's health patients for the rest of the week, Wednesday, Thursday, Friday. So the growth is, it's there, but then the small practice intimate feeling is starting to be lost. And that's kind of what I want to try and keep, but at the same time, grow to one of these bigger conglomerates. So I'm eventually going to need another, an NP, probably maybe even 2 within the next 6 months. But like you said, I want to get a system down I want to make it so when someone calls my office, they have a competent MA answering the phone, and just makes it so when I either for me or for when a nurse practitioner, is working for me, whether it's telemedicine or in person, it's like basically I need a rock star employee that's basically, I want the person to be able to come in, see a patient, whether it's virtually or, in person, and then, know where to order from which compound pharmacy, and just like an easy process for everyone, the dream,
Yeah.
So that's kind of the goal.
Dude, if you get the right person, you'll have that rock star in 1 to 3 months after you train them. Like, yeah. Oh, absolutely. Yeah, for sure. Should you have a female MA or a male MA? That's another thing too with the men's health practice. You want to keep it all male. And what I have found, man, is that honestly, a lot of my patients like the female MAs. Like, they feel like they can kind of relate to them, with their relationship stuff. And it's like more like a motherly kind of feeling and that sort of stuff. And then they get stern medical provider, from the male NP. And then the same thing, like if you have a female NP, having a male MA there seems to kind of balance it out. So keep that in mind.
Yeah, definitely.
Any other questions, man? I mean, you're killing it. You're just the right place, the right time, and a lot of luck here. I mean,
yeah. And that's why I tell people say, I do get messages all the time. The more I either comment on the post or people find out about the form and read the interview, the interview you did with me. Yeah. I mean, it does not take any specific, like I said, absolutely no, and I mean no business experience before this. Half the terms that you talk about on like your marketing, your marketing Friday and stuff like that. I don't know what the hell you're saying. You know what I mean? Like people think that I'm like this guru, but I'm just the average nurse practitioner that likes helping people and wanted to was sick of working for someone that didn't care about me. And it's just like I think as nurses we're all engraved and told we have a job. This is our cap. We're only going to make a certain amount an hour unless we work more hours. And I think people really should just, realize how powerful they are. You can prescribe medicine, you can change people's lives, and you can do it without having to, get burnt out. Now, if you told me I was doing something I didn't enjoy, like primary care and working 90 hours a week, there are some direct primary care practices that I'm sure that are making a killing, but, I don't want to work 80 hours a week to make, 50,000, a month revenue. I mean, 50,000 a month is good, but 30,000, 20,000. I hear people asking me, oh, I'm doing an infusion clinic and I'm making this much money and I'm spending this much time. And I'm like, either you got to hire more people to take time off your hands, like you say, or add another niche service. But it's a game changer. And, financially, it's financial freedom, as long as you do the things you also talk about as far as investing properly and living below your means and not increasing your lifestyle, which that was the only thing, I tell people, like, the only thing that I really brought in was that I was a firm, avid David Ramsey follower. Not firm, but I knew the Dave Ramsey program. And once I started looking at how much I was making working 80 hours a week for a hospital and, looking at how much Uncle Sam was taking away and how I had, student loan debt and another baby on the way. And my wife had student loan debt and all this debt piling up. And I was like, you do the math of how much you take home and the lifestyle expense. It's like, you're going to be working for 50 years and I don't want to be 90 and then finally be financially free. I want to enjoy life now. So, yeah. It's
dude, you're on the path, brother. You are, man. Like there is no reason why you can't be totally 100% financially independent by the time you're 40, 45 with this kind of money that you're making. Yeah. Pay that mortgage off and every dollar that you have that you're not spending, break it up, be diversified, throw it into some mutual funds, index funds, open up a brokerage account, maxing out your self-employed IRA 401k at, $61,000 a year and, buying some rental real estate, investing money back into your business so it's working for you. So then that way, 5 years from now, you can just step away from this business and it is just a machine on its own. Like you don't have to do much. You know what I mean? If you do all those things, there's no question that you'll basically be early retired in the next 7 to 8 years. There's no reason why you can't. So
yeah, exactly.
Yeah. Well, is there anything else that you want to talk about? Any other questions you got?
No. I guess the only other comment I would say is that I'm super excited to hear about the functional course that you mentioned the other day. But other than that, no, man.
Yeah, so we're planning on launching, a comprehensive functional medicine course for nurse practitioners. I'm partnering up with 4 to 6 other nurse practitioners who are kind of specialists, experts in a certain functional medicine field, and we're going to just put all of our brains together and just pump out just a crazy course on functional medicine that even primary care providers, whoever can integrate in their practice immediately. So I'm really excited about that, man. I think it'll be an awesome course. We recorded this in May, so we're hoping to have that out in 3 months. So
awesome.
Hopefully. Yeah. So we'll be an August launch or something. Yeah. So, well, I like to end the episodes with you asking me a question, man. Do you have any personal questions or anything that you've always been curious about?
I guess my personal question for you would be what's your overall goal? It's not really personal. What's your overall goal for the Elite MP? I don't know if it's your business, but I know you got a baby on the way. What's your 3 to 5 year plan?
3 to 5 year plan for the Elite MP or just?
Yeah. I guess, the Elite MP and your practices and, what's your stepping out strategy?
Sure. So ultimate goal for Elite MP in the next 3 to 5 years is I want it to be the number one continuing education company for nurse practitioners, on the market, basically. Not only, practice startup education, marketing, those kinds of things, but I also want to build another line of courses out for clinical education that offers, continued education credits and whatnot as well. And just building just a group of just hundreds, if not thousands of nurse practitioners who've taken the courses, who have started their own practices and whatnot, and seen if we could all get together and just build out just something magnificent. You know what I mean? Like our own credentialing, like another AANP or something, but specific for nurse practitioner practice owners or something. You know what I mean? So It's one of those things, 3 to 5 years, you can have some long-term goals, but at the same time, you never know what can happen,
Once the world starts opening back up, have some in-person conferences, and I would love to use my business account and go to take my family to Vegas for a nice long Nevada conference.
Yeah. Oh no, for sure. Conferences are definitely in the works, man. I definitely want them to be in like super cool locations, so all the business owners can just write it off. You know what I mean?
Yeah.
So yeah. 3 to 5 year goal for me personally, probably gonna go with more like a 5 year goal. Is I want to be literally 100% financially independent off of passive income streams outside of my businesses. So real estate and essentially my brokerage account. So like, I want to be like, 5 years from now, if I wanted to, I could totally just step away from my practices, close them all down. I'm not going to do that, but like I could just close them down. I could stop Elite NP if I wanted to completely and just literally walk away and be completely independent based off my investments alone. So I think in 5 years, I'm on track for that. I think I could probably make that happen, but I won't. I won't give up my businesses, man. That's not going to happen.
I don't know.
Yeah.
Could you ever see yourself working for someone else again? I know you said you recently left the urgent care. You're basically per diem. But it's hard. Would you ever see yourself working for someone else again?
Never. Never. If I was to work for someone else ever again, it would be at like a job that would just be fun, like bartending or something like that. Something I don't, or at a golf course or something like something I don't need the money. I just want to do something. You know what I mean?
Yeah.
Yeah,
exactly.
Yeah, but
I agree.
No,
I agree.
Absolutely not. Not as a nurse or a nurse practitioner. Absolutely not. Times would have to be pretty tough for me to go back to work for someone else.
Agreed.
When are you going to leave your part-time job? Why are you still there?
Strictly because of either one, being too lazy to, or two, not trusting someone to set up benefits for me and the family. It's probably my next 3 to 6 month goal. I'm there 2 nights a week, 8 p.m. to 8 a.m. And it provides me with, about $4,000 take home every month, which is basically put towards my mortgage and, living expenses, which, 2022 inflation, it doesn't really cover much. But
right.
Between that and, the health insurance, that's really all I use it for. But, in the next probably 2 to 3 months, I'm probably going to put my notice in and go to like per diem, maybe like 1 day a month. God forbid, I'm kind of a risk avert, I am someone I like to avoid risk, God forbid, I always have like this idea in the back of my head where the DA is going to kick down my door and realize I've been, giving people, scheduled drugs or whatever, the board of New York State, I'm kind of a lunatic when it comes to that. But probably the next 2 to 3 months, I'll be, basically 1 day a month. It's just a matter of getting benefits set up that are equal to what I'm, getting now at the hospital and just pricing it out. I know that they've kind of become a little bit more affordable. And I actually, I don't know how legitimate these companies are. I've actually been reached out to by a couple of people that, specialize in getting healthcare providers, cheaper rates. So it's either that
for
or
health insurance.
I get this.
Dude,
I actually got to
go to the Elite NP preferred vendor list, the Elite NP GPO. We have a vendor there for health insurance, man. Kincaid Solutions. Like they're there.
Perfect.
Yeah, like affordable health insurance for entrepreneurs. Give them a call.
Yeah, awesome.
Yeah, I wouldn't worry too much about that. I mean, you're making enough money in your business, dude. You could easily pay for a solid health insurance plan for your, for your family. Yeah, at this point.
Yeah, between that, like life insurance, and if I could just find something that relatively equitable, equal or what they were getting, because my wife, is not although she's working for the business and works harder than I ever will as far as raising my kids and keeping stuff around the house. Unfortunately, I'm the provider of the benefits as well. But it could be something that it doesn't have to be exactly the same, because I'm kind of someone that I'm relatively, at least when I see I'm healthy otherwise. So I don't think I'm dying early on. But I like to have set up. When you have 2 little ones, it kind of changes perspective. If it was just me as a single guy, I would just whatever. I wouldn't even have health insurance. I just take care of myself. But
right.
So if I can find something equitable, I'll check out the preferred vendor, because that's the goal, right? It's either I keep doing what I'm doing, where I'm up all hours of the night, Monday and Tuesday nights at the hospital, seeing patients from the hospital and working on the business that way, and then catching up at 5 o'clock in the morning every single day that I'm not at the hospital and never having a day off, versus, getting those 12 hours twice a week, those 24 hours back that I could be, either
Dude,
catching up on sleep and
you know what?
spending time with my family.
Yeah. You know what you could do with an extra 24 hours a week?
I know.
Jeez.
Yeah.
It'd be life changing.
Yeah.
Yeah.
I know.
Yeah, I think that should be one of your main goals, is to get the hell out of that hospital and just focus 100% on yourself. I had similar fears, like, oh my God, what if someone closes my business down for something? Or, what if I'm breaking the law? Or what if I kill a patient and get sued? Or what if, what if, just paranoid thoughts, within nursing, you're kind of trained almost to be paranoid about everything, you know what I mean? But it's hard to break out of that mindset. And dude, when I left the urgent care, 3 or 4 months ago completely, honestly, dude, I look at my bank account. I don't miss the paycheck, dude. I don't.
Yeah.
I don't even notice it. It doesn't make a difference. You know what I mean? But I have so much more time back. It was one of the best decisions I ever made. I think it'll be one of the best decisions you ever make too. I really do.
Yeah. Agreed.
Yeah. So, all right, was there anything else you want to talk about?
No, man. I think we covered most of what I needed for the business. I'm a BS artist. So I could sit here all day, but then I would complain to my wife later about how I'm, so behind on work, and she gets sick of me more than she already is. So, yeah, no, I think that's good. I think this is great. What I needed. I'll start working on, the getting those systems down, and of course I'll message you if I have any, questions like I always do, and annoy the heck out of you and Justin Gross. So,
all right, sounds good, brother. All right, well, I appreciate your time.
Yeah, man. Have a good one.
All right, man. You too. Bye. I hope everyone enjoyed the conversation with Patrick. Patrick is absolutely killing it. So his success is multifactorial here. Sometimes you just can't replicate someone else's success, okay? A lot of it is luck. A lot of business is just luck. Being at the right place, offering the right service at the right time. So a lot of Patrick's success is because of that. But what you can replicate is choosing an area that's not saturated, okay? Choosing an area where there's not a service, doing market research, checking it out, checking around. Does my area have IV infusion services? Does my area have men's health? Does it have weight loss, etc.? You just check to see. You deliver the need. And also going into an area where there is, at least 20 to 30,000 people, all right? If the county has 100,000 people, you are good to go. And also providing excellent customer service. Good customer service results in word of mouth marketing, and a lot of Patrick's success is simply just from word of mouth and providing excellent care. Now, when you start a practice, you can get to a point where you have to hire employees, you have to scale it, you have to grow, you have to do things to get it to the next level. Patrick can continue doing the things that he's doing now, okay, and absolutely kill it. Make crazy money, but at what expense? His family, his marriage, his mental health. It's not worth it to a point, Working yourself to death like that is not sustainable. It is not what a business is there for. A business is there for it to work for you, okay? A business is there to generate wealth, financial independence, and to give you back the most precious resource of all, your time. You have to hustle. You have to work your ass off at first, okay? I have, lots of other nurse practitioner entrepreneurs have, okay? It's part of the process. But once you get to a point, it's now time for your business to start giving you back your time because you put so much time into it. So you have to develop systems. You have to hire staff. You have to develop procedures, okay? It is part of the growing process. All right, so it's a good episode. Patrick's killing it. It was a pleasure talking to him. If anyone has any other questions, please shoot me an email. You guys take care. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2022 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.